Please join us for an Inventor Spotlight and learn more about the invention and development of the Polar Ice Hot Cold Glove.
My name is Raymond Wurapa. I'm an orthopedic hand surgeon, and I'm in practice in Columbus, Ohio, where I've been for over 20 years now. I have a great group of partners that I work with. I see mostly hand injuries, which is sort of what led me to this specific device and design. Very much a patient advocate. So, over the years, I've become more and more focused on what my patients truly want and what little things can help sort of make the wellness experience better for them. So something like this, I think, fits in well. It's not a pill. It's not the surgery itself, but it's one part of the sort of the wellness journey that I think can be helped by having something that's just more sort of intuitive, convenient to use, and reusable, so you can have multiple applications from the same thing, and also relatively inexpensive, considering that the one device should have a extended lifespan because it doesn't require a lot of abuse during its daily use. Around 2015 or so is when I think, the wheels started turning. And, from concept drawings, napkin drawings to, and I would just keep chipping away at it till I got something more substantial, and then trying to decide where the elements would go. And then eventually connecting with the Brown Med team. So I looked at different ways. Obviously, I have you know, I'm very busy doing what I do at work, taking care of my patients. So I needed the right team to sort of help take this forward. So I looked at various companies out there that were doing similar things, making devices to help patients with their healing and medical issues. And I came across Brown Med, and that just sort of jumped out to me when I made contact with the team. Um, the vice president of product management at the time, was returned my call. We had a long discussion. He understood really what the specific function of this device would be, and was very interested in finding out more. So, over a series of further meetings, we sort of honed things down, and then came to an arrangement of how this, collaboration could potentially work. And from my standpoint, I thought I would be as flexible as I needed to, just to see this go from, design board to final product. And these things just take time. There's a lot of iteration. There's a lot of material testing. We had to find the right heat/cold element to use that could tolerate both of those, that would be reusable. So there's a lot of science that goes behind the design. The same device can fit your left or right hand. It comes in different sizes, and you can apply the temperature to the hot or cold temperature to the top part or the bottom part of the hand, depending on where the injury is, etc. So that all came about during the process with the Brown Med team. Sometimes I would mention this concept to a patient while we're in a room, like, hey, wouldn't it be, or would it be useful if there was a device that did X, Y, and Z? And they would give me feedback on how it would be more beneficial to them. And I would sort of, thank them for that input and incorporate that into the design. And each time I went back to the drawing board, I just modified things just a little bit. So the patience of just that development time, for one, and then really the patience of, because we're dealing with sourcing materials, and that doesn't happen overnight. So the team was excellent. From my, I have nothing but great things to say about the responsiveness. Really, all the materials, they would send me packages. All right, here's option one, option two. What do you think? I did some of the material testing myself here with heating and infrared thermometers to sort of measure how long the heat would sort of hold up. They did some testing in-house too, but it was very collaborative. I mean, for the inventor, the collaborator, I thought it was a very sort of fair, engaging process, where I didn't just sort of feed something into one end of the tube and wonder or wait for something to pop out at the other. It was very engaging along the entire process, where we would have multiple meetings about how about we change this, how about we change that, send prototypes over, for me to test out. And during the process too, there were occasions where I had professional society meetings close to headquarters, and I would swing by the office and get sort of an in-depth sort of briefing on where things are and meet the team. And that's always nice, a face-to-face meeting, and sort of review some of the issues that we're working along. So the process just took time, but I think I went into it knowing that it would take time. And you come to learn over a career that some of the best sort of end results are the process, or come from the process of just letting things evolve naturally and organically, and not sort of forcing solutions. I remember meeting with the owner, with the CEO of the company, which sort of, I think, cemented things. So I was thinking this seems like a great match. And then I sort of talked to the, sort of the person responsible for sort of setting the tone, the culture, and the direction. As a person-to-person interaction, I was impressed after talking to him that it just reinforced that I made the right decision to work with, the right company and the right team. And from that point, it's sort of, no looking back and no regrets. I get great feedback with this device. So my patients with arthritis issue, which is a lot. I mean, the medicine has improved to the point where we're controlling a lot of medical conditions. People are living longer. And unfortunately, with the laws of physics as they are, joints eventually, will start to talk to us down the road. So I see a lot of patients with arthritis issues in the hands and the wrist. And this is one sort of non-pharmaceutical option, which, again, heat always sort of helps soothe that arthritis pain. And after a long day, I have nothing but great feedback about patients using the device and getting that comfort and being able to sort of still have some use of that hand during their treatments. The therapists in my group will use this and suggest it to patients that have issues that are relevant. But just a network of therapists and some of the platforms that I'm on, once I let them know that it was a completed product and it was available, I did see a lot of interest. Like that's what their livelihood is also, is managing patients with these hand injuries. And they could clearly see where the role of something like this would come into play. So professionally and from the patient standpoint, I've gotten, great feedback as far as the place for this device, along with all the other sort of tools we use to take care of patients. Great sort of memories with the meetings that we had at headquarters was seeing sort of the conference rooms with all the iterations of the different other products that they're working on. So it's a very busy team. There's a lot of different sort of products that they're working with. A lot of useful devices that, again, help patients manage different aspects of their injuries and their healthcare. I think the final product is excellent quality-wise, durability. I mean, it does everything that I initially intended it to do.